broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. Welcome to March 12th, 2019. We have quite a bit of material to go through today, and so we wanted to make sure that you sit back, relax. All of the slides that you're going to get today are going to be sent to you later on this afternoon. And again, the whole point of this presentation this morning is to really take a step back and look at how your current procedures and processes are done at your offices. And as we go through each of these, figure out, is there a way to save time and increase efficiency by using some of the resources we're going to go through today? And hopefully at the end of this presentation, you'll find that there's a couple of things that by outsourcing those will free up capacity for your offices internally and make you more efficient. If you have any questions today, please go ahead and send those to me. And at the end of the presentation, I'll go ahead and get to as many as I can. And if not, I'll go ahead and send you an answer and I'll actually include the answer so that way everyone benefits as well. Thanks again for joining us. I'm Pat Hennessy with Beere&Purves. Just came back an 80s cruise with Kenny Loggins, so relaxed and ready to go here this morning. The couple things, the agenda today, as we look into this, are actually, let me come down here. Here we go. There we go. Sorry about that. So here's what our agenda is going to look like today. Number one, we're going to go through the carrier highlights, which is going to really share with you what is selling, what is not. And before we go through that, we're going to talk about competitive plans by county, so that way you know exactly where that employer is located and which carriers are most competitive by county, by plan design. That way, when the renewals come up, if they're already with that carrier, you know that they're on the most competitive plan available. Some employer contribution strategies. We want to talk to you about this because there's an assumption out there that the large group, which is over 100, with composite rates are always the best way to go. We've found that a lot of groups 80 and up, when they're asked to certify, are you over 100, a lot of them are fibbing and they're over 100 to get the composite rates. But what we're finding now is that small group rates under 100 are actually more competitive. The renewals have been on averaging single digits. Large groups is averaging about 13%, depending on the SIC code. And again, as we mentioned, SIC codes, for those that are larger, if they have a bad SIC code, small group rates are definitely the way to go because there's no additional charge for any type of SIC codes. They're all the same. Required notices. This is the time of year to get in compliance. We did have a situation I want to make you all aware of when we get to that, where we had a group audited because of an employee disagreement, and I'll explain to you that in just a moment. EaseCentral. EaseCentral is now called Ease, just like Kentucky Fried Chicken with KFC. EaseCentral will now be only known as Ease going forward, so just be mindful of that. And then the resources and website enhancements we want to make sure you're aware of to, again, save time and increase efficiency, which is what our goal is today. One of the things, before we go into the carrier highlights, I wanted to share with you what is most competitive. And as we go through this, you'll notice here in Northern California, if that employer is located, let's say, for example, in Contra Costa County, which carrier is most competitive? And again, you're going to get a copy of all of these. So let's look at the middle column here, Area 5, Contra Costa, San Francisco. You'll notice here, if we're going to go with, for example, a silver plan in Contra Costa County, what's interesting is that the Aetna plan is most competitive for silver. Bronze, you'll see it's United Healthcare. And if it's gold, it's Anthem. And so you're starting to see some mixing. Last time Anthem had predominantly dominated all of these spaces, but now some of the other carriers are choosing their spots where they're finding that they're more competitive. When you go to San Francisco, to our left, you'll notice that we've got, if it's gold, it's going to be Anthem. And if it's a higher deductible within Gold, United. And United is dominating there in San Francisco. Whenever you see this parentheses with the percentage in it. So for example, let's look at San Francisco silver. It says minus 10.21%. So what that means is that the next most competitive silver plan, that 2200, is going to be 10% higher than this United plan. the next most competitive carrier. So anytime you see the percentages that are higher and you're not with United in this example, you really want to be offering United, because in this example, they are 10% lower than the next most competitive silver plan. Anytime you see something over here on the right, which is United Healthcare, and you see how it's a minus 0.64, that means it's less than a 1% difference between the United plan referenced here and the next most competitive carrier. So therefore, it may not be worth moving for less than 1%. Typically, we're seeing at least 8 to 10% before a plan move typically makes sense for the group size. But depending on the premium, that could be significant. So now have an idea of the carriers that are competitive here in the second quarter, which is 4/1, 5/1, 6/1 effective dates. Now let's go back and go through the carrier highlights. So step one here is Aetna. And again, Aetna has not been overly competitive. However, we are starting to see a lot of business move to the Bronze 6000 plan, which is the HSA. And that is significantly less expensive than some of the other carriers out there. And as we toggle back to when we go down to this Bronze HSA, you'll notice under Contra Costa County, which is stunning, look at this Bronze HSA with Aetna. It is a minus 19% below the next most competitive carrier. So that is a significant discount. If you go here to Alameda County, it's 17% lower. So Aetna is really going after the Bronze HSA marketplace, and for those that want to have a catastrophic plan in place, Aetna is your way to go here in the second quarter for carriers, for employers that are based in our Bay Area region. The other thing we wanted to make you aware of is if you do go with the Bronze HSA, please make sure that the business is in by the 20th of the month prior to the effective date. As you know, all the other carriers typically allow you to the 6th of the month following the effective date. They are very militant about that 20th deadline. We did have, unfortunately, some groups that were Q1 groups for March, and they missed the cutoff date of the 20th, and they had to roll to a 4/1, and the rates were a little bit more expensive. So just be mindful of that. Anthem Blue Cross, Live Health Online. This is really the future of medicine, where, and I actually have personal experience with this. My son had a sore throat and was having a little trouble swallowing. We took a picture of the throat. We went to Live Health Online. I'm a Blue Cross member. There was 10 doctors on standby to choose from. We picked one that we felt comfortable with based on their credentials. And all of a sudden, on my cell phone, the doctor was on top, we were down below, and we were communicating back and forth. The doctor looked at the picture, asked us to actually go into the bathroom so we can have more light. He looked at the issue, said, I know exactly what that is, sent the prescription to CVS, and we were done. You're not leaving your house. You're not waiting in a doctor's office getting coughed on. It is really an amazing way to go. It is not for everything. Obviously, if you have a more significant illness or injury, you want to see a doctor. But Live Health Online is really something that, and seeing a doctor virtually is a great way to go. If you've never tried it, I would highly recommend it for anything that is a minor situation. And what they're doing now is to encourage people to use it. The first 3 visits are free, excluding the HSA plans. It includes postnatal care. They want to make sure that people are not racing to the emergency room for non-emergency related items, and it's really keep healthcare costs down, and that's one of the objectives there. So when you do go to your enrollment meetings here in this going forward, please, if they move to Anthem, make sure you mention and educate your groups on how Life Health Online works. We have a brochure on it, and it's really very simple, and it's an excellent way to access medical care in a very efficient way. Out-of-pocket network. So if you go out-of-pocket with the PPO plan, you are going to be punished. They're increasing the deductibles to $2,000 and up. So it's another reminder, please stay in network. We do have a gentleman here in our office. His name is Patrick Kim. Anytime you move a group from carrier A to carrier B, let's say we're going from Shield to Anthem, always ask for the executive team and say, look, who are your doctors, specifically pediatricians, OB doctors, and then give us that list and the list of medications that they're on, and we will actually give you a side-by-side comparison, which are going to show you're currently with Blue Shield, these are how these medications are covered, and these our doctors are in network. If we go to Anthem, These are how these are going to be covered. That will go from a tier 3 to a tier 2. That one's not covered. That doctor is at network. Give that back to the group before they make a final decision, and you will have a very happy group. We did have a couple that blew up here in the fourth quarter because once we moved them over, because the pricing made sense, the CEO's doctor and medications were not on the list, and therefore they decided to pull the plug at the last second and not move the group after an enormous amount of work was done. These networks and the formularies for doctors and medications are getting narrower and narrower as carriers are trying to figure out ways to increase profitability. So it's really incumbent upon you and your team to grab the information ahead of time, give it to us. We're happy to do that work for you, provide you with that comparison, and it'll save you a lot of grief down the road. You know, we don't want to have a situation a couple months later the CEO's family cannot get their medications and see the doctor they want. It doesn't make for a happy client, as you can imagine. The two new EPOs, don't worry about them. They're not real competitive. So, and again, EPO simply means in-network only on the Prudent Buyer network, which is the largest Anthem network, and no network, no coverage out of network. The next promotions are really important. So let's say you have a group, and we did have a couple of these in the fourth quarter where we had 7 people on the bill, and we were able to go ahead and give the bill not to the E9C to Anthem and got the group approved. Comes in handy in certain situations. 25% participation, very helpful. Group of 25 go on to Blue Cross, the rest can go on to Kaiser. Obviously under 4 and under, you see the 65%. Individual coverage and exchange of valid waivers. This makes it very simple to go ahead and have a group approved. One of the things that we ran into a snag in the fourth quarter, there is a Christian medical coverage that's being promoted, and a lot of it's gaining a lot of momentum. It's very inexpensive, and a lot of employers and employees are joining this organization. The problem is when we submitted the waivers to Anthem, advising them that we had these folks that were on this Christian medical program, they're saying it's not valid group coverage, and therefore it's not a valid waiver, and the group blew up. So make sure that you understand some of these nuances that are coming out. Make sure that they are actually deemed medical coverage, because if they are not, they're not a valid waiver, and you will not meet participation, and your group may not be approved. So let us know if you have any questions on that. The other thing is, again, you can have a full and a narrow HMO, but you cannot have a full and a narrow PPO. We are starting to see some brokers trying to figure out how to lower healthcare costs, and if we can go ahead and do an analysis in the Bay Area, and if they're able to get the narrow network for other carriers, they're putting them on the base plan as the narrow network, and their buy-up is the full. But keep in mind, you cannot do that with Anthem. They will not allow you to have the select, which is the narrow PPO network, as your base, buying up to a full PPO. It's not allowed within Anthem. As far as HSA vendors, there was been a change. So ActWise is the new HSA vendor within Anthem Blue Cross. So if you get questions on that, please be mindful of that. Also, there's going to be new ID cards that are going to be sent out to all your Anthem groups, regardless of their anniversary date. If they're renewing, let's say in October, they're going to be getting a new ID card now, and the group's going to be calling you up saying, why am I getting a new ID card? My renewal is not till later on in the year. The reason is because Anthem changed their pharmacy benefit manager. They now are doing it themselves versus outsourcing it, and they had to give out new ID cards so that way those charges are done properly. So there's going to be a new RX bin and PCN number on the ID cards, and please make sure that the employees use the new cards. Because it's going to make sure that their pharmacy charges are billed correctly. And then lastly, with the dental, anytime you have groups under 10, we are starting to see a trend where brokers are bundling everything together. The medical, dental, vision, life, all with the same carriers. Anytime the group's under 10, it just makes it easier. It's one bill. And for Anthem, for example, when you look at the dental, it is a very rich dental plan that a lot of brokers don't give it the time of day. It has got implant coverage, cosmetic, the posterior composite fillings, very rich benefits here on par with some of the other Mets and Guardians. So It's important for you to understand. Please make sure to at least get a quote packaging it together, and you'll be surprised, specifically with a 90% UCR, how competitive these plans can be. Moving on to CalChoice. One of the common misconceptions was that now we can do 3 tiers. Yes, you can do 3 tiers. However, bronze is not included. So there was some misunderstanding there initially when this came out. So please make sure you can do a bronze silver, but you cannot do a bronze silver gold, but you can do a platinum gold silver. So that's just making sure everyone understands how that works. They removed the late fees. This created an enormous uproar. When somebody was late with their bill, they would get a 50% charge, and the groups were freaking out. And so they've done away with that, but they have increased the administrative fees for California Choice. And again, just a reminder, if you have a group on Kaiser Direct, and if you're going to move them off anniversary, you cannot go to CalChoice. Only go from Kaiser Direct to California Choice at anniversary only, which brings up a solution, which is Covered California. So Covered California, Kaiser alongside Blue Shield is typically what we see here in the Bay Area. You can also have Blue Shield out of state, which is very handy. And again, the rates for the Kaiser are less expensive for Kaiser Direct going through Covered California when you have families. So we are starting to see a trend because the unemployment rate here in California is under 5%. Everyone who wants a job typically has a job. So if I'm an employer, I need to make sure that I am in the best position to attract and retain employees at my company. One way of doing that is to offer plan design options that are in addition and beyond Kaiser only. We're finding a majority of brokers here in the Bay Area, 50% of their groups are Kaiser. And so what we are starting to see is migration from Kaiser Direct over to Covered California, because the charge for pediatric dental and vision is $14 per child per month. You add that up and multiply by 12, that's what you're saving by going to Covered California, because the Kaiser pediatric dental is not included in that plan design, so it's less expensive. Most groups have a standalone dental plan, so they don't necessarily need the Kaiser Direct pediatric dental coverage. And so we are starting to see movement. Kaiser Direct always at least offer the Covered California option. We do know some people have had some past experience with Covered California where they're not happy. We have just brought them on as a partner, and we've been monitoring it very closely to make sure that the service levels are increasing and getting better and better. We submit the group through EaseCentral, and therefore the processing times are much faster than they've ever been in the past. And we've been very happy with them, with the groups we submitted so far. There is no administrative fee. That's a key difference between Covered California and CalChoice, which is also making it less expensive. They did have an option to go 50 with an out-of-state, making it very competitive. That option no longer exists. You can move, again, Kaiser to Covered California off anniversary. You have a 12-1 with Kaiser Direct. You hire a new employee, they have a sick child, they need to go to Stanford. That employer needs to figure out a solution, move them to Covered California, put them on Blue Shield. Now that employee goes over to Stanford. All the other employees stay on Kaiser. Those with children pay less. Obviously, there's that trend that's going to be factored in, but you can move them off anniversary. For those of you that are not licensed with Covered California, please be aware that you do have to go through an hour certification. There is no test. It's a very simple process, and we would encourage all of you to be certified with Covered California. We do not want to see anybody lose a group going forward because they did not offer Covered California, and we just had one happen last month. So please be careful and make sure you're offering all the options to protect and retain your groups. HealthNet has struggled. They're competitive on the HMO side, narrow networks down in Southern California. If you do have 10 or more enrolled on HMO only, it doesn't require that DE9C, and they do have that Live Health Online. United Healthcare. This is something that a lot of brokers, there's been questions regarding. There are 6 portfolios. It is very confusing. I'm going to be very transparent and honest with you. It is very confusing. What you want to do is educate your team internally. Use Choice Simplified 3. Choice Simplified 3, it excludes the Platinum HMO. Again, in Northern California, 80% of what we sell that are non-Kaiser are PPO plans. In Southern California, it is directly the opposite, 80% HMO, 20% PPO. Northern California, 80% PPO, 20% HMO. The Choice Simplified 3 is the portfolio you want to be using. You want to be very careful when you get your renewal because, again, you've got 6 portfolios. If I am on a 2000 plan and they migrate me over to the next most competitive plan, it may be in Choice Simplified 4. And you have to make sure you understand that you can only offer plans in that Choice Simplified 3 portfolio. So if I get a 2000, I may have to take a $2,200 deductible because that is in that silo of Choice Simplified 3, which are the only plans I have available to me. The other things, again, Southern California, they have Harmony, which really not a big issue up here. Alongside Kaiser, very effective. And again, as we're looking at groups leaving Kaiser Direct, if we have a senior executive team and they want a Platinum plan, we put the 5 of them in California onto Kaiser Platinum, onto UHC Platinum, and then everyone else, if needed, would go on to the Kaiser Bronze plan. And you see a fitness reimbursement, and then there's goals. If you get hit certain goals, you can get money back for that as well. So now what we're going to do is we're going to go on to our next topic, which is strategies. And so what I wanted to do now is talk to you about a contribution strategy. As you know, most employers will pay a percentage for the employee and dependents. Typically, we see that more significantly amongst the white collar, where they'll pay both a higher amount for the employee and dependent. Minimum, as you know, can be a fixed dollar amount. But the reason I'm bringing this up is that when we talk about larger groups, we have the ability to make a composite rate. And so I wanted to show you how this works. So let's say we have an 80-life group and they want to be in large group. So because they like composite rates. Well, did you know that we have the ability to make age-banded rates composite with this simple calculator? So let's say they're paying $50,000 a month, and let's just make it $20,000. They're paying $20,000 a month in premium. And we know that they have of their 20,000 here, and we know that we have of this group, we have 30 that are employee only, and we have 20 that are going to be employee spouse. We have 5 that are going to be under the employee children, and then we're going to have another 20 that are going to be with employee family. So with that combination paying $20,000 a month, you'll notice the automatic composite rates. So this is what some brokers are doing. They're able to go ahead and make it simple for that employer that is desperately trying to stay out of small group because they do not like the age-banded component. This allows, based on the total premium, we figure out what the total premium is on a age-banded basis. We figure out how many employee, only spouse, family, and it automatically defaults into a composite rate. Now, there's a couple things I want to make sure that you're aware of. So let's say that we give this to an employee only, and let's say this averages a 40-year-old rate. This is all just hypothetical. And let's say we hire a 25-year-old. So that means that in this situation, you're technically overcharging that employee. And if you hire a 60-year-old, you as the employer are going to have to absorb the difference. If you have any questions, please let me know, but it's a way to go ahead and at least provide composite rates for larger groups that may be interested in looking at this as a solution. Now let's go back to our plan designs here. EaseCentral ongoing maintenance is something that's gaining momentum with our team here internally and a lot of the brokers. We have an enormous amount of time being spent at the broker office with one of their employees that is their job is to go into all of these central accounts every single day and determine which items need to be adds, deletes, which has to be taken care of at the carrier level. We are now in a position to do that for you. So for example, if we write a 20 life group with you, and it can be of any size, and if you'd like us to do the ongoing maintenance, we are in a position to do that for you at no cost. We have a team here that will go in every day based on the groups that you want us to look at. As soon as we see that there's been an ad, a new enrollment application through EaseCentral, we will email you advising you that we have a new Anthem Blue Cross application. We have sent it to Anthem for processing. As soon as that individual is processed, we send you a note back saying we have completed it, they are now enrolled, and you are all set. So this is saving a lot of time and expense at the broker's offices because we now have the ability and a team to go through this, and we would encourage you to give us a try. And so, for example, if you have a smaller group and you're doing this yourself, let us do the little ones. It just frees up capacity for your team to do other things going forward. If you have any questions on this, please let me know afterwards, and we'll make sure that these get answered for you. Broker picks. Now, what these are, this is basically an opportunity for you to increase revenue for your office and increasing your agency profitability. Anytime you have groups that are 1 to 4, let's put a pot plan in place for you. It's free for the first year. After that, it's $100. If you'd like the commission on it, it's $150. We pay $50 to you. And we have the attorneys review the pot plan, and that's why it's the $100 there. Groups 5 to 19, you can have the items there, and groups 20 or more, we will pay for the items that you're seeing listed there. Now, if you have EaseCentral, and if you want us to reimburse your EaseCentral monthly expense, the way that works is that if you have a 30-life group, for example, we will pay you $1.40 per employee per month. So in that example, you'll see 30 employees times $1.40 times 12. That is $504 that we will pay EaseCentral on your behalf to reduce your monthly EaseCentral subscription. Some brokers are actually having their entire EaseCentral subscription paid for through our office here because of the relationship in the business that we've been able to partner on with them. So take advantage of this. These are all available. Again, we want to increase profitability for your agencies, and this is definitely one way of doing it. One of the other items now that we're in a slower season, we want to focus on now in compliance, and obviously finding new groups are the two big concerns right now. Now let's focus on the first one because it actually does both. This required notice checklist, every single one of your employer groups should have gone through this required notice checklist based on their size. So for example, if we have a group that is a 12-life group, you notice that if they're between 1 to 19, these are the required notices that that employer should have already completed. They should have a summary or plan description, and as you'll come down here, they should have a notice of special enrollment rights. They should have wellness program disclosures. All of these items need to be included in order to avoid litigation and fines. I mentioned at the beginning of this broadcast that we had a situation come up, and it was a little disturbing because it was an employee of a 12-life group that went in and the employer gave them an HRA account. So the employee took the money, it was $100 per month, and they spent it on on dental expenses. They went back to the employer for the reimbursement for the HRA, and the employer said no, that HRA money was intended for medical only, not for dental, and did not reimburse them for the money that they had spent. The employee was disgruntled and went to the Department of Labor and said, this was not clearly outlined by the employer, and I want my money. So the Department of Labor showed up at the doorstep of this 12-life group and said, we're here to talk about an HRA issue, but before we go there, let's go through this required notice checklist and to see, making sure that since we're here, that you've got all these items in place. And unfortunately, this 12-life group didn't have any of these. It resulted in a $30,000 fine because of one disgruntled employee. And this is critical for you as brokers to retain. Let's start with retention. You want to make sure that nobody else comes in and goes through this checklist with your groups and you don't have these items checked. It's important for you to understand you don't have to pay for all of this, because at the end of this brochure here, which I'm going to give all of you at the later today. If you want to have this done, HR 360, Sterling, or Task are all vendors that will make sure that your groups are in compliance. Your job is to make sure that they're aware that this is something that is their responsibility. You can give them the vendor's information and they can go ahead and purchase it themselves, and now they're in compliance. What some brokers are doing is using this as an opportunity to take a broker of record from an existing group. They come in with this checklist. The checklist is blank. And then they've got the dollar amount for the fines off to the right-hand side. And as they go down the list with the employer, they ask them, does your current broker provide you with this information? Oftentimes the answer is no. They will go down there and check off the ones that they don't have, and then add up at the end the total cost of a possible fine if they were ever audited. This is really compelling, and this is causing groups to change broker of record to make sure that they're not in this situation. So I would encourage you, right now that we're in a slow season, please make sure that you go through each of your groups. Make sure that you've at least advised the group that they should be in compliance. You need to give them this list, give them the references, and then make sure that you've taken care of your groups internally. On the offensive side, you want to use this as a great prospecting tool. This is one of the most compelling ways that we're seeing new brokers going out to secure new groups. You know, we've seen people on the phone say, you know, if I can save you 10%, can I have 10 minutes of your time? You know, that's really not effective because obviously the rates are the rates. But this is really effective, and very few groups would ever pass 100% a compliance audit. So we want to encourage you to use these tools to your advantage, both to attract and to retain your groups. As we move on, website enhancements. We want to talk about this website, and we want to make sure you're familiar with it because it has a lot of items that will really save you an enormous amount of time. So the SBCs are required by law, and let's go through here and show you how to access those. So let's say I'm Anthem Blue Cross. This is our website here. And now we have a 4-1 group. We just click to the 4-1 effective date, and we know that this group that we went through, they basically were, these are the plan designs that we sold them. We download this, and we can download up to 10. And now we have the zip drive that we send to the group, and now their SBCs are done. Very effective way of making sure that you're in compliance. So again, it's under our resources tab. It's under the partners. This is partners. This is Anthem. And when you come in here, you'll see SBCs. By law, you're required to have the date. Whatever that effective date is, you can go all the way back to last year if you need to, and you'll grab it and then grab the plan designs, and you can send these over to your group immediately. Very efficient. We come back over here. The other thing, that's your brochure. The brochures tab is the other one I wanted to share with you when we come under brochures. You'll notice, depending on, let's say we have HSAs, it'll come right down here, and now we have some of the flyers that you need. There's the medical contract code. This is when we talk about plan migration. Some of the old plans have gone away and gone to new plans. This is going to help you explain what happened. There's an infertility rider that's available here. All of the brochures are able to just click, and it becomes a zip drive, and off you go. Very efficient. The SBCs, we talked about that. Search functionality, let's go back over here. Now what we're going to do is we're going to go under underwriting. So you go to back pocket, and we're going to go under the medical comparisons, or let's go network comparisons here. And we have certain doctors or certain hospitals that we have to have access to because we have some sick kids. So we're going to go here in Alameda, Contra Costa County, and we want to make sure who's in which network. So here's Anthem, here's the Aetna full network, and here's the full network here, and let's go ahead and pick the PPO full network, and here are the narrower networks, which are right here. Now we hit compare. So what's interesting about this is This tells you which hospitals are in the network right away. The red means it's out of network. So this HMO focus, HMO you'll see doesn't have a lot of the hospitals in it because it is a narrower network. Here's your select, here's your core. But this gives you an idea quickly. If I need to go to Valley Medical, I need to make sure that I go to the Health Net Full PPO. You'll see that's not in the network here. So this is an important tool to be able to reference. The other thing, when we come back here, again, these are all under your back pocket. And now let's say we have an owner-only group. So now we go to underwriting. Underwriting, we're going to go under medical, because we don't understand the rules for owner-only. So we're going to collect all the carriers, and we're going to come over here under owner-only groups, which would be, see where it says owners and husband and wife? We're going to click that one. And what this does, as you come down here, is can anybody write a husband and wife group? And the answer is no. Nobody will write a husband and wife group. But what if we have a W-2 that's eligible? So we look under Anthem Blue Cross, and now all of a sudden, let's say we have a child that is 20 years old that works at the company, and they're doing filing, maybe they're doing some marketing, shredding, and that kind of thing. We add them, and as long as they're eligible, which means they're making minimum wage, working 30 hours a week, now we can write them. They're going to waive coverage because they're eligible, and now we write the group. In contrast, over here, that 20-year-old would have to enroll separately in order to have it written through Aetna. So you really want to be careful. Is it enrolling or is it eligible? You'll notice that the Anthem is more friendly because all that W-2s has to be eligible, and they can waive, and then we can write the rest of the group. That's important to know. So that's all under the medical. Some of the other things that are going to be coming soon, you'll notice that the details are going to be listed when we have the quotes. You'll actually be able to do the detail summary, so that makes it very easy as well. Some of the partner services, and again, this is a great review because oftentimes when we meet with certain broker offices, they're not aware of the level of assistance that can be provided. So as we look at this, you'll notice that we do have a sales team. I'm fortunate to have on my team, we have Heather and Tracy for the quoting. Any assistance you need with the enrollment support, I'm happy to do on-site meetings. And then we also have the ability to have translators. So anytime you have an enrollment, translators, as you know, are very expensive to bring on site. We cover that cost at 100%. And if you want to have a Spanish and English enrollment, the translator will parrot your conversation, or you can have 10 o'clock can be English and then 11 o'clock can be Spanish, and you'll just be parroting that conversation, and it really makes it for an efficient enrollment. Under the quoting side, there's final rate generations, which are very helpful, the enrollment support, the education, the employee training. We do have some new folks coming into this industry, and so if you have at your offices anybody that's new, we offer boot camp, which is Healthcare 101 for group benefits. Gives them an excellent overview of the entire process of small group medical and their understanding of how the whole process works. So we do that every quarter. Let us know if you have any new employees, send me an email, and I will make sure that they get added to our next educational training seminar. And then we have the underwriting component there as well. Before I say thank you for joining us, I just wanted to go back through and let you know you'll be getting this component here. You'll be getting the required notice checklist, you'll be getting the contribution strategy, and you'll also be getting this entire PowerPoint presentation. We are out of time here, but I wanted to go ahead and thank each and every one of you for joining our presentation this morning. If you do have any questions on what we reviewed today, please let me know. Some of the last things I wanted to share with you, which are regarding the prospecting. We are seeing more brokers using texting, which has never been used in the past. A lot of brokers feel reluctant to use texting when they're communicating with their clients. You usually use texting when you're communicating with friends, but we now are seeing more brokers introducing texting in correspondence with specifically younger business owners. Oftentimes they'll send emails, they'll leave voice messages, but as soon as a text is sent, they get an immediate response. So don't be afraid, when appropriate, to use texting as part of your communication with your new prospects and existing clients especially. I want to thank you for your time today. Any questions you have, let me know, and you'll be receiving a copy of this in its entirety later on this afternoon. Thanks so much. Take care. Bye-bye.